I am the Chief Climate, there we go, that sounds right. I am the Chief Climate Officer for New York City and Commissioner of the New York City Department of Environmental Protection, and I am honored and privileged to have the opportunity to moderate this morning's conversation around climate change and health. We've got a really exciting and distinguished panel, and we've got roughly an hour to discuss. We'll have a conversation here among ourselves on a couple of questions, but then, at least in my experience, it's always really exciting to hear questions from the audience. So hopefully we'll have a good bit of time for that. And I'm going to apologize in advance because I realize there's no clock and I don't wear a watch. So I'm going to keep track of time on my phone. It is not that I am doing Wordle, I promise. But let me go ahead and invite our panelists just to identify themselves in their own voices, please.
Hi there, I'm Jodi Sherman. I am an anesthesiologist from Yale University, and I'm the co-chair of the Lancet Commission on Sustainable Healthcare.
Morning, everybody. I'm John Balbus. I'm the director of the Office of Climate Change and Health Equity in the Department of Health and Human Services and serve as a Deputy Assistant Secretary for Climate Change and Health Equity. And I'm an internist and occupational environmental physician in my training.
Good morning, everyone. I am Ruxandra Draghia. I'm also a medical doctor, and I'm the chair of the Scientific Advisory Board of INTREPID Alliance, an industry alliance focused on small molecule antivirals, and as of Monday, the head of R&D of Novavax, a vaccine company.
Hello. I am Awa Marie-Cole SECK from Senegal, and I am former we can say senior minister to the president of Senegal and also Minister of Health. I have been for some years also in the UN in rollback malaria and UN AIDS.
Excellent. So I'm looking forward to learning a lot. I am not a medical professional. I am a climate change guy, but you know, this topic is so important, just certainly from my perspective as a policymaker and somebody trying to think about the city's overall efforts on climate change. And it really is in both kind of the impact of climate change on health, but there is also, not to be forgotten, an impact of healthcare on climate change. Here in New York, one of the things that I oversee is what we call Local Law 97, which is a mandatory decarbonization law for buildings. All large buildings in New York City, roughly 65,000 buildings that are 25,000 square feet or larger, have a mandatory climate budget, basically, based on their use type and their square footage. And they have to meet targets that decline every 5 years, starting now through 2030, through to net zero in 2050. Hospitals are included. They have a slightly different compliance path, but they are, of course, one of the toughest nuts for us to crack in terms of compliance. But at the same time, we're also focused very much on resilience and adaptation to climate change. And there we see so much of the epidemiological impacts of climate change. It starts with the most vivid and obvious, where here in New York City, only 3 years ago, we lost 13 New Yorkers who died from flooding from Hurricane Ida. Of course, 12 years ago, we lost 43 to flooding during Hurricane Sandy. But what's less visible to the public, but I'm sure well known to all of you, is the fact that in New York, I am always talking about the extent to which the biggest climate killer in New York is heat. And we think we've lost 350 New Yorkers over the last decade due to hotter average temperatures in the summer. But they aren't quite as acute, they aren't quite as vivid, they don't come in a crisis moment in the same way, and because they are almost always disadvantaged, that doesn't get the same kind of visibility, but it is one of the reasons, and one of our policy initiatives we're working on, is moving towards a mandatory indoor cooling law for New York City, which again, on its own, has other climate impacts because most of the time we're trying to reduce energy consumption. But this is one where we've made the decision that the public health benefits are so significant we can't escape it. And so with that, you know, I wanted to actually start off, since we do have both of these topics to discuss, with perspectives from the panel on the footprint of the healthcare industry on the carbon emissions and other emissions that it creates, and what we can do about that. And to that, I'd like to start with Dr. Sherman, please.
Thank you very much. So the Lancet Countdown on Health and Climate Change, which I'm a member of, has been tracking the health sector, global health sector, national health sector emissions for the past 6 years. And we know that globally, healthcare is responsible for nearly 5% of total global greenhouse gas emissions. And of course, greenhouse gas emissions are not the only type of pollution for concern. Of concern, we also look at other types of health sector impacts, and importantly, what is the disease burden? And we can say that 4.6 million disability-adjusted life years are lost annually due to health sector pollution globally. And importantly, about 1/5 of the emissions is coming from the med tech sector. So this is a real call to action for the sector here represented to help do their part.
Interesting. And maybe Dr. Balbus, what are we doing about this?
Well, just to put a little bit of additional nuance on that, the health sector, of course, is comprised of the supply chain, which is the vast majority of the health sector's emissions, and then the actual provision of clinical care. When we look at clinical care, a lot of that has to do with the energy in the buildings, which RIT is taking care of. So, we can go ahead and decarbonize the energy supplies of healthcare, but then we're left with still a lot of the emissions still to come. And I think that part of the driving force of the emissions from the healthcare sector is are the let me put it this way: the least polluting care is the care that we don't have to give, right? So as we're in a system that incentivizes the provision of more and more care, the emissions go up, and the supply chain emissions that are associated with that go up. And so, healthcare has a very different set of motivations, set of incentives. There's a primary do no harm. There's a primary keep people out of the hospital motivation, and the more we can do that, the fewer the emissions from the healthcare sector. So there's kind of a clinical practice. There is a health equity side of this. As the healthcare sector focuses more on social determinants of health to prevent health disparities, to prevent the development of obesity, diabetes, asthma, chronic disease, and mental health problems. That's actually a green strategy too, which is kind of a unique way to think about it. I just wanted to put that out. The supply chain is part of the general economy, so a lot of the distribution, the decarbonization of electricity for the med tech sector, for pharma, will be going along with the decarbonization of the general economy, and we need to move the general economy along in that way. So in terms of what we're doing, I think that the health sector is lagging, especially the healthcare delivery sector. There's been a kind of an exclusionist feeling that the mission of health is so important, it should, in general, not be constrained by environmental regulations or environmental concerns. Physicians should only care about the patient in front of them. That's starting to change. I think that we've had this phenomena where since 2020, we both have had the worst pandemic in 100 years, and also the most clear manifestations of climate change killing people month after month, year after year. And so the motivation is up, and at the same time, many parts of the health sector are saying, we're just emerging from a pandemic, we can't do this, we're too stressed. So, I think we're at a moment in time where the private sector has to lead and to take the mantle and to join the general economy, really, in decarbonizing and reducing the emissions.
Joining obviously the economy, I can just put forward some data that is coming from the International Federation of Pharmaceutical Manufacturers and Associations, so IFPMA, and note that about 80% of the companies, which are the biggest manufacturers, have net zero targets, and about 97% of the companies actually have sustainability targets. It is interesting to see because it's not only about the large companies, it's also about the biotechs, it's the small companies. And for instance, at Novavax, the company that I'm joining next week, they are working on to do their part in sustainability. So for instance, the adjuvant that is used in the vaccine is actually from a tree, from a saponin. Well, those trees need to be actually exploited, if you wish, in a very environmental friendly manner. One needs to think about the waste management, the ventilation and the air. So all these elements actually are contributing directly or indirectly to what you are discussing. And I think that while we don't have a magic bullet and each of the companies will actually undertake whatever fits their model, it has to be everyone doing their part.
Maybe just a word on what I have seen in my continent, Africa, where everybody knows that we have a very weak health system in general, and it is where the supply chain and all these things also will be less developed and maybe have less emissions. And this is for me something who is growing. It is not going down because we are also trying to develop our system. At the same time, we are in a situation where we are using some of what people are promoting, like solar energy for our health structures. When you are building a new structure, often you have also solar energy there. But one of our problems will be more waste management, because this is a real problem in Africa. And we need to also look at it when we look at this issue of what the system is doing to contribute to all the situation we have today and climate change in general.
Thank you. And I will just add the kind of perspective from a policymaker that one of the challenges I see, and I was saying this to our panelists before on this topic, is because healthcare is so sensitive, it is very easy to scare people when you are making policy to say, oh, well, you can't require that of the healthcare system. And of course, the healthcare industry has very good lobbyists. And so the question of whether healthcare will ever be put under the kind of mandates that we need economy-wide, I think is one of them.
If I could just speak to that,
Please.
though, I mean, one of the things our office is doing is documenting the case studies that show that especially this issue of the decarbonization of the energy supply is a complete triple win. Not only does it reduce the emissions and protect, against the other pollution that's associated with fossil fuel combustion, it makes the systems more resilient. So the systems that have their own solar microgrids and battery backups are the ones that are going to survive when the grid goes down. And we've seen this happen time and again. In Sandy, we've seen it in the hurricanes in the Gulf Coast. And then the third thing is it fixes and reduces operating costs. Electricity's going up, 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 and it's only going to keep going up. When you have your own system, you fix it, and you know exactly what it's going to be, and it tends to be less, and it tends to be less and less over time. So we're focusing on community health centers. We're focusing actually on the systems that serve the most vulnerable patients, and they're able to generate more revenue or save their revenue and put it back into patient care. So we just have to make that case. Yes, that argument will be made, but that argument is made in every industry. Right. And in general, that argument tends to be not true.
That's well said. Thank you. Let me change gears a little bit and then think about what we know or what we're already seeing about the impacts that climate change is having on health itself. And I guess perhaps to start, Dr. Draghia, AKLI, if you could begin, what do you see in that area?
I'm going to be a bit gloom and doom. We are working on emerging infectious diseases, and we have seen dramatic increases in diseases that have not been in certain geographical areas up to now. So take, for instance, vector-borne diseases like the mosquito or the tick-borne diseases. We have seen tremendous increases as of lately. Take, for instance, dengue. We had 6 million something dengue cases in 2023. As of September 2024, we have seen globally about 13 million cases diagnosed of dengue. And not all the cases of dengue, only a sliver are actually symptomatic and diagnosed. We have seen, for instance, West Nile virus, which is starting to be endemic in the United States. We have seen cases in 47 states, 800 neuroinvasive cases this year in the United States, and local transmission of dengue in Florida, in California, in Texas, aside from U.S. Virgin Islands or Hawaii, where, one might think that the vectors might be more prevalent. We have seen cases of Zika. And that is actually going up and up and up. Last year, we had actually a locally transmitted case of malaria in Maryland, which we haven't seen in 40 years. So unfortunately, with climate change, we are obviously seeing these diseases increase in prevalence, with a population that also is burdened with non-communicable diseases, such as high rates of obesity, of diabetes. Of course, that the impact of those diseases are going to be increased. So from my perspective, we really have to pay attention much more. And in the panel this morning, the panelists were mentioning how little attention was given to women's health. And we were talking about 10% of R&D budgets going to that field of activity. Only 0.5% of R&D budgets are actually going to emerging infectious diseases, and entire areas like new treatments, are almost ignored. 9 out of 13 families of viruses have no compound in clinical development, and 10 out of 13 have no compound in preclinical development. So I think that, from my perspective, the situation is really dire.
So in terms of the United States, I sometimes like to think about those impacts that we are seeing now that are ubiquitous and that are pretty well attributed to climate change. A set of impacts that we're seeing now, but they're a little more local and perhaps not quite as clearly attributable to climate change, but they're climate sensitive. And then there's other impacts that we think are probably happening, but we don't quite have the surveillance systems. So in terms of what's happening everywhere and is ubiquitous, and you kind of started us up on this, heat is number one. Heat mortality, as we measure it by death certificates, anybody wants to ask a question about that, I'm not going to go into how we measure it, but just if you look at the CDC death certificate data, it's basically tripled since, between the aughts and the last 4 years. And we've been setting, heat wave records in this country. So, and everybody's experiencing that. It's a little bit different the way it manifests in a northern tier state, where it's often elderly, isolated people, in an apartment with no air conditioning, versus places like Maricopa County, Arizona, where we're seeing huge rates of death in people who are experiencing homelessness, mental illness, et cetera. So heat. And then, of course, heat has all kinds of other effects that we're not measuring quite as carefully. It has effects on pregnant women and preterm birth. It has really devastating effects on children. Sleep deprivation and learning. There's very clear correlation between high classroom temperatures and impaired learning. So that's heat. We're seeing air pollution impacts ubiquitously in this country now, mostly the West, but we've seen it in New York and Washington from wildfires primarily, which cause very high spikes. We've been able to document some asthma incidence increase from that, but we know that air pollution has cardiovascular effects, mental health, neurologic effects, et cetera. And then the third, and this is one that is just getting more attention now, is the mental health impacts. The paper was just released. It was a survey of about 10,000 young people in the United States. 85%, that's pretty ubiquitous, 85% of the people surveyed in this country said that they were worried and having anxiety about climate change. 58% said that they were very or extremely worried. Now, if you want to do math on that in terms of burden of disease, in terms of suffering, in terms of need for intervention, it's pretty outstanding. And you know, if you look, and when they ask, the thing that is most disturbing to them isn't necessarily seeing the manifestations, it's the inaction on the part of government and industry. So if we want to think about the benefits of climate action and having leadership and taking steps, think about the mental health of our children, of our young people, of our young adults. Those are the top three. You've mentioned the infectious diseases. There's other kinds of weird infections, valley fever, Vibrio in localized places. And then, you know, we have anticipated for years changes in foodborne and waterborne infections. Surveillance systems in this country aren't great. It's very hard to see it, but it's probably happening, you know, in some cases just because we know bacteria reproduce much more rapidly if they're outdoors in that, you know, proverbial egg salad or whatever, chicken salad, the bacteria reproduce more quickly.
Interesting. Dr. Kolsak, could I ask you to share how what we've just heard compares and contrasts with what you're seeing in Africa?
First of all, I would like to say that globally, for the first time, when you look at the agenda of the COP 28, it was the first time we had a day, complete day for health and climate change. Before, it was always one small session somewhere, but it was the first time. People are now very clear and with a lot of figures showing that we have a real impact of climate change on health. But we need to say that in Africa, we are contributing only 4% to the green gas emission, but we have 35% of the death linked to climate change. We have there a real problem. The problem is that the north is polluting, but the south is suffering. This is a reality. It is why I think that maybe later we will have to discuss more in depth what we need to do, because if we are not looking at this issue, you will see that some of part of our countries, if they are not disappearing, they will be in real trouble. What we have seen, as you said, you say malaria is happening some cases in the US, okay? We have hundreds of thousands cases a year in Africa. But what is very surprising is that you have now malaria in places of Africa where they didn't exist. We look at, for example, Ethiopia. In the mountains, they didn't have any malaria, but now they have. You can see I can say beginning of 2023 to 24, we had something like 19 countries in Africa having cholera epidemics. This was not common. Before you have 1, 2, maybe, but now it is very huge. And a lot of people are dying. This is the situation, I can say, without going into details, because we have also dengue, Marburg, you have all this disease today. Rwanda today, people are almost not traveling a lot because they have their Marburg. It was not there. They didn't know it. You have Ebola before in West Africa. We never had Ebola before. But we know that something is changing. This is the situation. But we are vulnerable. We have no capacity to look at. When you say that in the US, in New York, you had some, maybe 100 people dying because of climate change, but you are able to do a lot of things to adapt, to mitigate. But the situation is Africa is that often people are there and things are happening and everybody is going in all directions, but it is a real problem because of capacity. This is why the capacity building is very important if we want this continent also to react. Now you have also a lot of problem of displacement of population. You recently in Chad, they have 1 million people displaced from Sudan and Ethiopia, Eritrea, etc. They cannot cope. They have their own problem, but they have to also work on that. All this is linked not only to instabilities and things like that, but also of the fact that a lot of farmers are not working anymore because of flood or because of drought, etc., etc. So this is the situation in Africa, but I hope we will discuss it also. The community, they are there, and they are doing their best. And this is the hope we have in Africa.
Dr. Sherman.
Yeah, so, yes, sorry. Taking it back to the global north for a moment, you know, another big issue that we're seeing, of course, and this is globally, but we have a recent issue with Hurricane Helene. And so physical injuries, complete destruction of local capacity to deliver healthcare, displaced populations, and interruption of supply chains. We're seeing this even in the United States. It's an issue globally. And so we are now facing dramatic shortages of intravenous fluid, which is causing cancellation of surgeries, cancellation required care. We are in crisis mode, and this is happening in the United States right now. And there's also a lot of relationship and lessons which we have not sufficiently taken from the pandemic, where supply chain interruptions have affected us globally. Nobody is immune to that. And those who can most afford to get those resources get them. And most of the vaccines, for example, for the pandemic, that went to the global north. So it's increasing inequity in access to the resources. We do not have enough pharmaceuticals, medical technologies to support the current needs of the population. And so when we are very wasteful in the global north, and we also have the resource to get a hold of those supplies, and so that is worsening the inequities.
I think that it is also a matter of thinking for many, many years that we are in a way protected in the global north. But all the data, all the modeling is showing that, for instance, by 2050, 1.3 billion people are going to be at risk of acquiring Zika. By 2080, 60% of the global population would be in that area where they would be at risk of dengue fever. So these things are evolving, and unless we find a solution that can address it globally, nobody's going to be safe. We've talked about Ebola. The outbreaks of filoviruses increased approximately 5 to 8-fold versus the previous decade. Some of the outbreaks were smaller than others. Now we have some solutions as far as vaccines and therapeutics for some of the filoviruses, and the response, for instance, in Rwanda and in other countries have been fantastic at this outbreak, which obviously is able to contain it. But the sheer number of outbreaks is actually increasing dramatically all over the globe.
Yeah, and I just wanted to add to that. So, you know, we should talk about mitigation and adaptation separately, right? They do go hand. The solutions are often one and the same. So improving our resilience to our supply chain, reducing wasteful consumption, moving toward more reusable medical devices that can increase our resilience to these interruptions at the same time as mitigate emissions. And these solutions have to go hand in hand. And, you know, we certainly overconsume, as we know, in high-income nations. And at the same time, low-income nations have to elevate access and quality of care before even thinking about things like mitigation. Although interestingly, we know many health systems throughout the global south are also concerned about mitigation. It was a bit surprising to me. And importantly, we cannot simply expand the way we are practicing in high-income nations now globally to achieve the universal health coverage. We have to figure out how to do healthcare differently, and that includes transforming our pharmaceutical and medical technologies.
Well, Dr. Sherman just started us off on what I thought would be a more positive way to wind up our session around what some of the innovations are. So what do we do about this? And Dr. Kolsek, you talked about the power of communities. Maybe I could ask you to expand on that a little bit, and then we can talk about some of the other kinds of innovations that are emerging.
Innovation is also, for me, the hope we have. And for Africa particularly, we think that with innovation, we can go faster to recover and to have a system we would like to have. When I introduced myself, I didn't say that I was the president of Galien Africa. We have our forum just last week. And one of the very important part is innovation. Innovation for young people, but also innovation in general. And we have some boosts for the young people to ensure that we are really motivating them, because they are brilliant. They have a lot of innovation they are doing for everything. But for climate change, they are also now involved. And we were very happy to have young people who are looking at irrigation, looking at seeds, looking at how to preserve also fruits and everything, just because of climate change. And this is also, we have also a prize like here, where it is not a lot of discover, not okay. It is not a lot of, is this working? But maybe we can speak?
Yeah, we can.
Okay. It is not only the research and development from the pharmaceutical, but also radiotherapy. We are looking at what we were doing before and how to put it at a level where we will be able also to treat our people. But innovation is also part of is one of the prize. Donc it's just to say digital innovation, etc. Donc we had prizes. This time is Morocco with the COVID diagnostic with new technologies. But we have also or we call it M health, because we are using in Africa, and young people are very also committed to do that. A lot of devices they can use for education, but promotion, but also to remind the women the time of their consultations, etc., etc. You have a lot of things, also the dossier of the patients, etc. Donc we think that innovation also in Africa is going on, and adapting the climate change impact to that. We have also in some area where it is very difficult to access the telemedicine, we is developing also a lot there. So I think that this is concrete example. I have so many to share, but I have no time for that. But just to say that it is a lot, and I think that the big problem will be financing to go to scale.
Mm-hmm. Thank you. Dr.
Um,
Draghia.
I think that we need to think in terms of innovation at an ecosystem approach. We've talked about surveillance. On the top of it, there are many places where we don't really have good surveillance, and that's a reality which is global. We need to talk about vector control. There are new technologies, there are innovations in vector control. So, you know, an article published a couple of weeks ago was pointing out that beyond the classical Wolbachia, so the bacteria that is infecting the mosquitoes, we have now deaf mosquitoes that are not reproducing as well. Is that a possibility? But we really need to think at the environmental impact of introducing this innovation. Then you have the diagnostics. We talked about the diagnostic. In order to really be able to treat, sometimes in the right window, you really need to have a positive diagnosis, and that entails, you know, an appropriate point of care diagnosis. So think COVID for all these other diseases. We do have work on vaccines, including, you know, like CEPI or WHO, who are looking at prototype vaccines for disease X. We have our INTREPID Alliance work on small molecule antivirals. So really, most of these diseases don't have specific therapies. So can we do more about it? But then it comes to the community engagement, as you have mentioned, as education and training. And the ecosystem is also, as far as the stakeholders are concerned, not only the approach. We have to have this ingenuity that comes from the communities which are affected, the academia, the biotech, industry, governments, all working together. Because, again, we don't really have a magic bullet. We really have to think how we are going to tackle the problem for all perspectives in order to be successful.
If I could, just to build on that, I totally agree. You know, there is so much space for innovation throughout the whole healthcare ecosystem. You know, I mentioned that the easy thing is to put up a solar panel and a microgrid. The hard thing is, what do we do with all of healthcare? And you've mentioned a lot of the things, you know, other things like eliminating the need for cold chain and cold storage, you know, heat-tolerant vaccines, treatments, et cetera, specimens. One thing that I'm particularly concerned about is that there is this massive investment about incorporating AI into healthcare, but you know, it's another one of those things where people aren't thinking environmentally about it, not only about the massive consumption of energy by the AI itself, but about the applications to, you know, predicting patients at risk for heat stress, to, you know, optimizing the delivery of care so that it's more efficient and less consuming. There are so many applications that could be done there. Real quick, two things that are going on within HHS. One is that we, I think, still have now a Kidney X Sustainability Innovation Challenge going on, where our office is sponsoring an innovation challenge to make dialysis and other aspects of end-stage renal disease care less water consuming, less energy consuming, et cetera. And then the big one, I hope everybody's aware that the Center for Medicare and Medicaid Innovation, in its team model, which I'm not an expert on, others may be, but you know, that's the main improving quality of care, reducing cost of care innovation chamber, if you will, for CMS, has a voluntary decarbonization and resilience component to the current team model. So the team model itself is mandatory, but they've added on a voluntary component for decarbonization and resilience, and our office is, you know, working closely with them to provide technical assistance and help them do that.
Oh, please.
So I would add a couple of things, including that we have a challenge of technology creep, that the latest and greatest technologies that are being developed are being expanded in their applications, and not often in an evidence-based way, but that also industry is driving this. Like, let's create a new patent on an upgrade technology, make it even, you know, slightly better. You know, do those changes really have an impact in improving healthcare outcomes, or is it really a business model approach? that is driving the throwing away of perfectly good technologies and the adoption of the latest and greatest things. Can we really think about R&D and in a way to also not only look at new innovations, but to innovate the technologies that we already have to make them more environmentally sustainable, more lean in their production, more efficient in their delivery. And of course, we need regulatory levers to grease the way to make it easier to get changes in existing products approved faster. But we don't have time to wait. You know, the world is rapidly declining, and we really should be spending a lot of time improving the innovations that the technologies that we already have.
Thank you. Let me ask at this point, we've got about 10 to 15 minutes left, whether there are questions from the audience. And I don't know if we've got a mic, but we clearly have a question. So that's a good thing. Here, why don't you use mine?
Thank you so much, panelists, for your insight. My name is Lancet. I'm the founder and CEO of the TechConnect Venture Studio, one of the nominees for the best incubator this year at the Prix Galien. So we leverage AI to advance precision health and climate for global social impact. And my question comes from youth engagement and global collaboration. So as a woman who is still under 30, I want to be a mother. However, this world right now is really giving me anxiety to have the children. And with, by the year of the 2030, with over 50% of the population under 30, yet we're not that, great represented in the decision making, both public and private sector. With all of you here, which you are in both public and private, how can we younger generation be useful? Because we don't want to, be passive and wait, right? We want to do something constructive and, helpful. And in terms of the global collaboration, we'll talk about global north and global south, which is great because it's driving by the funding needs and for the collaboration, right? But what about the east and the west, which is right now, in a more divisional world, and the UNJ also talk about how nothing gets really done for the past 5 years just for the AMR. So would be very curious whether this climate health section, this nexus would be the new kind of the area that will spur the global collaboration, and how can we kind of, make that happen? Thank you.
Thank you. Any takers? Quite a set of questions.
So the point is very well articulated and very well taken, and I see incredible engagement and uprising of youth voices at the COPs. We are participating with Youngo, with the UN's youth organization. We're participating with the We Are Family Foundation, which is a smaller group that brings, outstanding youth leaders. It's kind of like what I see in healthcare, though, which is that, the leadership, that there is a group, in the vanguard, if you will, that there are youth leaders who are brilliant, who are articulate, who are compelling, who are in there and actually really making a difference. But sometimes I feel like the bigger group of youth are a little more passive and a little checked out. And 85% of them are worried, and 58% of them are suffering. So one of the things that we're working on trying to do, in addition to trying to show that climate action is happening, which I think is the most important thing we can do to get at the anxiety about, your own personal choices, is to build kind of mental health resilience and climate resilience understanding into youth, the youth empowerment programs, ubiquitously. So things like AmeriCorps, that are already in communities, that are already working on addressing social determinants of health, or addressing tree canopy, or they're doing all kinds of things, but to be a little bit holistic in the thinking, and to improve the peer counseling skills of youth, so that youth can be supporting each other, and also to engage them in action for their own communities. There's a lot of transgenerational work going on, so we need to support it, though. I mean, it's not well supported. AmeriCorps is not well supported. Climate Corps is not supported. So the last thing there is, I think there's a screaming need for advocacy from everybody, but especially the young people in our communities.
Often we are saying we agree. We agree the young people need to have their voice heard. The young people need to be also in the decision process. The young people, it is always very clear and theoretically, it's what we need to do, but we need to do it. It is why, again, the Galien Africa Forum is 4 days, and we have 2 days for young people, 2 days. The first day is that we are having a training, would start before the forum, something like two months. The best student, medical, biotechnology, etc., from Africa, from the universities, are coming to Dakar before online, but the 2 days are in Dakar, where we are really focusing on leadership. And this year, for example, it was artificial intelligence, but before we had another theme together. And they are there as leaders from Africa. And we think we are creating a sort of network of all of them. And it is becoming big because it's the 7th edition in Africa. And we will have others, I am sure. And this is important to have them also working together. And we have the second day is on innovation and focusing more on young people. I think that we need to have more and more way to give them the possibility to express themselves, but also to grow. And it is possible also because we are also creating an intergenerational network to ensure that they are also using the experience of older people and will not do the same mistakes than us. This is another example I wanted to add to the discussion.
Thank you. And, oh, please.
Maybe I can give an example of collaboration. In global health, everything is about partnership and collaboration because the diseases are global and because the knowledge sometimes is very fragmented. We've talked a little bit before about that ecosystem approach, but that has to be, integrated into the innovation. If not, if one of the parts is failing, we will not have an appropriate response. So it is integral to what we are trying to do to really work together. For instance, in our therapeutic coalition in INTREPID Alliance, we are a coalition of pharmaceutical industries because everyone is bringing their own knowledge, the innovation, the ingenuity, and making their little part. Science is very complicated. Some of these diseases are called disease X because nobody knows what's going to come, and maybe a new virus or a new bacteria or a new variant is going to emerge from somewhere. So we actually need all that collaboration in order to be effective.
Yeah, did you want to add, please?
Yeah, I mean, I'll just add briefly that the past 2 years there has been to COP a special youth envoy. And they actually just launched their own official youth group at the World Health Assembly. So that answers part of your question. And I would say on the education front, in my experience, the transformation in education, speaking mostly about medical education, but other health professions as well, it is being driven by young people. It is not being mandated, it is being requested and developed and implemented by young people. And I would hope it would become mandated. In the UK it is, but the point is that this is being driven by the youth.
And if I could, just from a policy perspective, I think young people need to be much more sophisticated about how to get their voices heard. I see a lot of yelling, and I see much less direct intervention at the moments where the levelers of power are actually moved. I see some of that, but I think being really sophisticated about how our political systems work is one of the things, and through social media, young people have power over people my age and older, that really needs to be further exploited. And a second thing, which I'll leverage from, which I believe is true for medicine, but more of my background from climate technology and other things, is the more widely available we can make research and early venture capital money, the more likely we are to get that really broad base of innovators. I mean, generally speaking, people don't win Nobel Prizes for work they did in their 50s. They win Nobel Prizes for the work they did earlier in their careers. And so that just means that the more widely we can disseminate that, the more counterintuitive things that we can fund early on, the more likely we are to have that kind of impact. We probably have time for one more question, if there is. Let me, with apologies, I'm going to go from the front of the room to the back of the room. This gentleman in the back.
Thank you very much. Great discussion and great panel. I'm Dr. Nelson Eluya from New Jersey, and obviously black, and I'm Nigerian. No understanding the statistics that Africa or Global South contribute about 1 to 2% maximum of global warming, and the impact on us is so much more. As a matter of fact, from 38 to 50%, as it may be. But to help mitigate the impact, especially with disease and emerging diseases that we just talked about, the biggest issue is finance and reaching out to those individuals who are in the continent who are most affected. Because if nothing is done, guess what? They're going to migrate. And so also with the diseases that you're seeing migrating up north. So to help reduce that impact, they need to invest and finance issues and innovations from the South. Now, how do those individuals, brilliant minds in the South, have access to that money? We talk about billions and billions of money that's out there. And they see that, they hear that, but they cannot access it. They have to be a structured, method that's set aside to truly reach those individuals and have them have access to that money.
Thank you. We've got 4 minutes left in this room, so I'm going to ask 1 or 2 responses, perhaps Dr. Kolsek and Dr. Balbus.
Thank you. I would like to say that this is a real problem. It is why those who are in the position of decision makers, government, etc., need to also advocate for flexible funds who can reach the communities. Because if we have all this bureaucracy with all the fun we have today, because it is not enough, but we have something. And this something needs to be used. And we would like really those who are the more vulnerable, the more affected, have access to that. But we need to ensure that they are flexible enough to be able to reach those who need it. The second point is we need to use also innovation in financing. And I think that public-private partnership also in our countries is something we need to push and to develop. We have also the possibility of use the death, because death relief is not anymore what we would like to hear. But we would like to hear that this can be redistributed and redirected to community which are the ones who need it. And I think this is more and more also audible. People and countries are aware and seems to agree. Now it is more the mechanism. But this is some of these issues we need to look when we look at financing and not just put everything on AIDS. I think we need to do things ourselves too.
Thank you. Dr. Balbus.
I'll just make 3 points really quickly. First, the mechanisms are being developed. There's a lot of controversy. There's a lot of discussion going on at each of the Conference of Parties. It will be going on to COP29 about the finance of adaptation in particular. One challenge that we have in climate and health is that a lot of the rules that get made about financing and the uses that financing can be put to gets siloed. So there's climate financing and there's global health financing. And there's too many cases where that's siloed and that, funds coming in and, I can't elaborate on that in the time I have, but I think that there's a need for the global health and the climate philanthropies to really figure that one out and have some flexibility. The second thing is that, I'm going to forget this. The second thing is that, the governments are lagging. The U.S. is lagging. All the governments of the world are lagging. I think there's a real need for the private sector to also step in a philanthropic way, and they're doing that in many cases. And then the third reason is, in the last, in the 4 years of the Biden administration, President Biden set very ambitious goals for finance from the United States, but they didn't happen. And why didn't they happen? Because Congress would not appropriate it. In the United States, Congress holds the purse strings. So, I think that there needs to be, that Congress needs to get the message that this is important, from an ethical and moral standpoint, if that matters to them, from a national security standpoint, if that matters to them, from an economic standpoint, if that matters to them. But that's ultimately, where the U.S. goes, much of the world will follow. If the U.S. doesn't go, much of the world will choose not to. So I think that that's a really important lever.
Thank you. Dr. Sherman, can I ask you to wrap us up?
I would say one thing we have not touched upon that I think is really vital is how we avoid greenwashing. And that requires standardized, transparent accounting of our emissions. And this is starting to happen through ESG, environmental social governance reporting, at the organizational levels, and also science-based targets to develop, using that information to develop strategic mitigation strategies. And this is being mandated in several countries, including especially coming out of Europe. I will say the other thing that is vitally important is that at the product level, we need standardized, transparent reporting, and this is very challenging, and so one of the suggestions we do at the product level. But the bottom line is we need that information to be able to do a better job. If you can't measure it, you can't manage it, and we have to have standards to avoid greenwashing, which happens unintentionally but also intentionally, and we have to address both of those, and I think that this has to happen to move things forward.
Excellent. Well, look, we could go on for a lot longer, but we are at time. I want to thank our fantastic panelists for a great conversation and thank all of you as well.